The first successful organ transplant was a kidney transplant in 1954. The donor was the identical twin of the recipient, and the new kidney worked for 11 months. This was long before any anti-rejection medications were available. Cyclosporine, the first anti-rejection medication, was approved for use in 1983. The use of anti-rejection medications has significantly increased how long transplanted organs will function. A transplanted kidney from a living donor will last on average 12 to 20 years. A kidney from a deceased donor lasts 8 to 12 years on average. Amazingly, the longest recorded kidney transplant lasted 60 years. Most people who have had kidney transplants for end-stage kidney disease are first treated with kidney dialysis. Since dialysis is an option treatment for end-stage kidney disease, people may wonder why kidney transplants are needed at all. Dialysis is not ideal, as it can only do about 10 to 15% of the work that a healthy kidney does. Dialysis is also very costly and time-consuming for the patient. The average life expectancy of a patient on dialysis is 5 to 10 years. Thus, dialysis is commonly used as a bridge to kidney transplants and not a replacement for a transplant. Kidney and liver transplants are unique because they can be done with living donors. For the kidney donor, once the kidney is removed, the remaining one will increase in size to adjust for the lost kidney. The portion of the liver that is donated can regrow rapidly, and the donor's liver will be back to normal size and function in a few months after donation. Donation of a kidney or part of a liver does not shorten the donor's life expectancy. Per the National Organ Transplant Act, neither the living nor deceased donors are compensated for organ donations. This is truly a gift of life that is given to the recipient. However, organ recipients may pay for their living donor's travel, lodging, and lost wages in connection with the donation. The donor surgery is often billed to the recipient's health insurance. The National Living Donor Assistance Center also helps eligible donors financially when they cannot have their expenses covered by the donor's insurance company, or state programs. Since 1954, over 1 million organ transplants have taken place in the United States. The Organ Procurement and Transplant Network reports over 42,800 organ transplants were done in 2022. Last year, 6,466 people became living organ donors. Thanks to organ donors, transplant recipients can live longer and healthier lives. Consider checking the organ donor box next time you're at the DMV. One day, it may lead to the gift needed for someone else to stay healthy out there.